Representative for the discussion. Representative Prusak.
Thank you, Madam Speaker, to the resolution.
The resolution.
Thank you. One of the reasons I'm proud to be a nurse is our long history as social justice advocates. Nurses see public health crises in our work, and to curb the suffering we see every day, we follow the trajectory out into the world where these crises begin and work to prevent our patients from ever becoming sick or injured in the first place. To me, that means providing every Oregonian, every American, accessible, quality, affordable health care. I was following that proud tradition when my fellow nurses and I testified on this resolution to the late Chair Greenlick on February 7, 2019 in Hearing Room E. I didn't imagine that day I would be sitting in his chair wondering what my legacy would be. I've given this issue a lot of thought. I want to leave behind an Oregon where healthcare is a human right, one that every Oregonian enjoys. I want to create an Oregon where people don't have to decide to wait for life-saving exams or medications only to suffer or get sicker. On any day, our lives can be flipped upside down by a diagnosis or an accident. Whoever you are, however important you are, human frailty is nonpartisan, unbiased, and knows no demographic boundaries. A person's opportunity to have a healthy life should be equally as boundless. Everyone deserves access to comprehensive, affordable, high-quality health care, including mental health care. Yet that is not the system we live in. Right now, life-saving, indeed life-changing health care is not accessible to every Oregonian. Some people dismiss the late Representative Greenlick's vision as an unrealistic dream, but doing so dismisses the greatness of Oregonians. We have the resources, intelligence, and talent to get this done. Oregon has already led the country in healthcare reform, daring to make improvements that other states envy, but we need to push ourselves further. It won't happen easily or quickly, but it is possible. This resolution moves us in that direction. During the devastating ice storms in my community, I lost power for 9 days. It was challenging, scary week for my community. Like so many of my colleagues, we spent the week trying to help our constituents get food and get warm. It felt like crises were piling up. During that time, I finally had the opportunity to finish a book. Reading by candlelight and headlamp, the book was capital letters, an inside view of the legislative process by Rep Greenlick. I know all of us have endured impossibly challenging and frustrating days as legislators. We ask ourselves why we keep doing this work. Reading this book during such a challenging time for my community was like having Rep Greenlick in my ear, mentoring me, reinforcing my why. As he always has done, he helped me keep working with humor and determination to help people. The last time we voted on this resolution was February 7, 2020. Rep Greenlick was sitting behind me at Representative Nose's desk. He was watching Representative Salinas and Representative Nose co-carry the resolution because his health was declining. I didn't take the chance to speak on the floor that day, but I didn't want to miss the opportunity today. Now that he has passed, it is up to us to carry on his legacy. So I want to finish with his words, like my colleagues have done. One will be a same quote that has already been said. Rights are a product of wrongs. They come from human experience, particularly experience with injustice. He said that on the floor in his speech in 2008. And one more quote from the closing of the book. If there is a most important takeaway message from reading this book, it is that the Oregon legislature comes to work and generally gets this job done, however difficult that job may be. Colleagues, this resolution gets us one step closer to correcting injustice. I strongly urge us to get this job done, and I urge your support. Thank you.